Let's look at the liver and gallbladder stones, how they work. Have the whole thing is liver. When you have fat, it's really not going to work properly. So when you have a amount of fat, that's the liver problem stage 1. If you have more than that, then liver problem 2. And if you have more than 66% of fat, then you are having liver problem stage 3. That's really severe. Here you have hepatic vein, right hepatic duct, left hepatic duct. So bile is secreted from liver and bile is originated here. So here it is right hepatic duct and it is left hepatic duct. So the bile from left and right go down here and then it goes there in the gallbladder. And this bile is absolutely necessary for the human being. So here bile is concentrated up to 5 times, so 500%, that is 5 times. When it's concentrated and when you have food in the stomach, it goes all the way down, and this is hepatic common passage. So bile comes from here and other things also secrete from liver by this common hepatic duct, right? So when the bile is necessary for the digestion. So when you have food needs to be digested, and with the help of bile, a lot of work is here done. That is, the food has been cut into small pieces, the fat cut into small pieces by bile. When you do not have gallbladder, what happens? You cannot have concentrated bile deposited. As you do not have this, as you have moved, what happens? The bile comes. If it is a lot of bile in the belly, in stomach, you will have dysentery, and if you have less than necessary, then you will have constipation. So gallbladder is a vital organ, but generally medical doctors, they say it's not that vital, but actually it is vital. It is something like the water tank over your roof. So when you have a water tank, you keep the water is there, and when you need, you turn on the tap and the tap water comes out. But if you do not have the tank over your roof, what happens? You have to switch the electricity on all the time when you need water. So this is vital. So you need to keep it. So what can you do? So what happens? The bile is concentrated here and it comes down and digests the food. This is very important. And what happens is that there may be accumulation, there may be collection, and there may develop gallbladder stones. And before gallbladder stones, you can say there is a deposit of bile slugs. When you have a lot of bile slugs, that turns hard and it becomes a gallbladder stone. And when you have gallbladder stones here, it doesn't much matter because no problem here, but little uncomfortable maybe, because when you have stones here and when this gallbladder is squeezed to release the bile out of the gallbladder, that may be uncomfortable feeling. But usually we do not have problem when we have gallbladder stones in gallbladder. But when one or two or more, usually one gallbladder stone comes out and is stuck here, this is cystic duct. So when a stone is stuck here, what happens? There is inflammation. Usually there's no infection. Usually there is inflammation. And what happens? The bile cannot go out or bile cannot get into the gallbladder. And then it really creates severe pain. It's very similar to the kidney stone pain, very similar. So one gallbladder stone is stuck somewhere here, and this disease is called cholecystitis. So chole means gallbladder and cystitis the disease, as it has been blocked by the gallstone. So this in this situation it is called cholecystitis. This is a serious problem. You do not have infection, but you have a lot of inflammation, bruising, and a lot of problems, and you'll have a severe pain, and it doesn't go away. If you have painkiller, it won't work. You have to have an injection, then you can get rid of the pain. But this is very unhealthy. But in the beginning, you can do it. But what is the best? If you go to the hospital very quickly, then there may be operation immediately. So that is the best. As soon as you get to the hospital, the pain has started and the doctor, uh, but usually it doesn't happen because it's very severe pain. So what you need is you have an injection, and then you get rid of this pain, and then you go to doctor, and slowly you can get diagnosed and find the solutions. But the problem is when the gallstone stays here for a number of days, it happens that a patient who has developed cholecystitis, here the gallbladder stone is stuck, what happens? They do not go to doctors, and then the pain comes and goes, so they may delay, and then what happens from here, the gallstone may come down and may get stuck in the bile duct, right? This is the common hepatic duct. So what happens, it's not just the bile, there are so many things. A liver works 500 things, so there are so many other secretions, so all they may get blocked. When they get blocked, there will be serious infection, there will be a serious condition. This is called choledocholithiasis. So choledocholithiasis, that means the bile duct is here and it is blocking the main hepatic duct, the way where by which a lot of hormones are secreted and they go into different parts of the body, especially in duodenum, that is in the stomach, right? So this is a severe condition. It is the highway, and this, so here you have this is your house, right? From the house, a child is on the road, or a vehicle has been damaged or stopped here. So the passage will have constriction, it will have very little narrow road, and when it goes all the way here, it may block the highway. So it is something like procession, demonstration. So when the strikes, there may be procession, demonstration, protests, then people come, take to the street, and they block the road, and the vehicles don't can't pass. So this is why the communication system stops. So here the same thing, the gallbladders, here you don't have problem, no problem, no problem. In the beginning, sludge, gallbladder sludge, and then bile sludge, and it's very soft, and later it gets hard and it gets into a gallbladder stone, and one of the gallbladder stones may gets out here stuck, and then this is cholecystitis. There is no infection, but the doctor usually gives antibiotic because they are more careful, right? They are more enthusiastic, then they can solve the problem. And when this takes time, when you do not go to doctor, when you do not have operation, when you do not have the gallbladder removed, then what happens, one after another, time to time, what happens, this stone gets down and is stuck here in the common hepatic duct, and it can also go down, and here you have pancreas, there you have duct, so all the ways here and there, the bile duct, that is gallbladder stone, may get stuck here. This is serious problem, right? And one woman gets her gallbladder stones all the way into the belly, into the stomach, and usually the stones can get out of your body from the stomach, but those stones may have been very big, and that's why they couldn't get out of, right, from the anal system, that is the excretion of your stool. and then she had to have her operation done and all this from belly removed, right? So here you have the umbrella term. Under the under the liver you have the gallbladder, and here you see spleen, hepatic artery, stomach, pancreas, common bile duct. So bile is very important. It is something like detergent. When you wash your dishes, you need some kind of chemical, that is bile, that is the detergent. And here in this body you have the liver secretes bile, and this bile comes down here and helps get rid of digestion problems. So bile helps it clean. That's it for now. Thanks for watching.